Many thanks, Ibrahim Bello Gunda, for that background report. And to get us into the conversation, I've now been joined by Dr. Gafar Alawudi, who is an expert in health financing. It's a pleasure to welcome you to Good Morning Nigeria.
Good morning. Thank you. Thanks for having me.
All right. Also with us here is Chika Ofo, a health advocate. Many thanks for joining us.
Thank you so much. It's an honor to be here.
And also with us for the conversation, for joining us via Zoom, is Vivian Ihekwazu, Managing Director, Nigeria Health Watch. Many thanks, Vivian, for joining us.
Good morning, everybody. Good to be with you this morning at NTA.
All right, let's begin the conversation from within the studio. The U.S. recently took decisions that, well, they say it's in their own national interest, America first. And one of it is to cut funding through the U.S. aid. Just how impactful will that be to a country like Nigeria?
Okay, thank you very much. And to start with, this is a very, very important moment to have this type of conversation. I think before we come down to what U.S. government did, let me take you to probably immediate memory lane that what we are seeing now is not entirely new. It's a trend that has been continuing. It's only at the scale we are seeing it that is what is causing these outcries. If you look at the global external spending on health, since the beginning of the Millennium Development Goal era is the era where we have the highest government external spending on health. It reached the peak around 2015. And since 2015, globally, it has not been increasing. It has been coming down gradually because of other commitment of all those developed world as well. And recently, in the last few years, the British government actually was an enormous cut in the amount of money that the British government was actually spending on health. Probably there wasn't much outcry because there was no political conversation around it. So the major programs of British government in health sector they actually called seriously. And coming to the decision of the United States government. So it's not only impacting through USAID. So USAID is not the only channel that U.S. government spend on health. You have BEFA, you have CDC, and they're spending a lot of money. I think the major area of impact, because if you look at this money in the health sector, is actually skewed to some priority diseases. That's HIV/AIDS, malaria, and TB. That is the area where donor money across all those three entities constitutes more than half of the total spending that we are spending. And the United States government is very, very, major donor in this area. Whether you talk about TB, whether you talk about HIV, whether you talk about malaria. So it's going to impact a number of things in terms of ability to get necessary commodities, ability to, there are some specialized health workers that are trained to provide some of those services, ability to get training, equipment, logistics, and everything. So it's going to impact a lot of stuff. But I think for some of us like this, we see it as an opportunity, in the sense that there has been advocacy for the past decade on sustainable financing for malaria, for tuberculosis, and for HIV. And the problem then was that it was very difficult to advocate for domestic financing when the money was still coming from abroad. Now, when somebody turn off the tap, quickly Nigerian government says, "Oh, we are doing." Putting so amount of money. So, like we had a webinar last week, and somebody said we should not allow this crisis to go to waste, because it's an opportunity for us to stimulate, to advocate for domestic financing for health. In the short term, of course, it's going to impact on things, and then for Nigerian government to be able to fill in the gap, we have to do things differently, and we have to do different things to be able to do that. Part of what we need to do is that it's not that we don't usually have allocation, maybe especially at the national level for some of this area. The money is not often released. That's part of the major problem. So we have to do things differently to ensure that we release the money, and then to ensure the efficiency of utilization of this resource. And it's not only about the federal government, but of the state government. All of us, everybody in Nigeria comes from one state or the other. You understand? So some of us have been advocating for state with the highest burden of HIV/AIDS in the country to spend more.
Step up.
Yeah, but it was only Lagos that was responsive. At the point, the Lagos state government increased spending on HIV by 500%. It was very, very impressive. That means it was possible. So I think we have to look at all levels. Now we're having local government autonomy. How do we bring the local government into financing for health effectively as well? I think those are things. I want us the narrative to be around opportunity rather than, oh, it's a challenge and everything.
If you say it's an opportunity and not a challenge, someone would ask, even with the funding we were getting, you know, I mean the US aid funds and all of that, the health sector was still struggling. Other ailments, I mean, that we were handling, we couldn't handle it. Very simple things. Maternal mortality is still high in this country.
Absolutely.
You understand? So simple things. I mean, so with this, are you saying we're not going to struggle some more? But you know, let's get to Chika for now. I'd like to hear what your perspective is. He said, well, it's the non-release of funds and all of that. But first and foremost, the budget for health in this country. Well, the 2025 budget has been passed, and I know that the increase in the total budget is as a result of trying to block, you know, some of the trying to solve some of the problems that would result from the US aid, you know, funds that have been paused. But, you know, speak to us really. Is there a way forward really for us in all of this?
Yes, before I answer the question, I want to say that my organization, Vaccine Network for Disease Control, was impacted by this US aid pause, as it were, because we have two programs, one on HIV and another one on malaria. So I'm going to use that example to answer your question. Immediately they paused. We have about nearly 600 children under 5 who are HIV positive, who need to take their drugs. So with this pause, what it translates to immediately is that they can no longer take their drugs, because though the drugs were in the facilities, pause means they cannot give you those drugs because those drugs are owned by US. So that immediately tells you what is going on. For malaria, I feel we can still cope with malaria. But for HIV, by the time you do not take your drugs over a period of time, I'm not talking about children. We have over 10,000 in where we are now who need to, you know, follow up with drugs. And it's painful because the way it came. While we're looking at the positive side, which is that Nigeria really needs to now sit up and take charge of the health of their citizens, the way it came. There are casualties that will come out of this, whether we like it or not. Collateral damage. So ask yourself this question. Many Nigerian children will probably die because of this. So let's put that in one bucket. And then now say to ourselves, what are the emergency things that we need to do now as a stopgap measure? That's what I thought people would be thinking about. The person that is giving you, it's like you living in a house and you're living in a rented house. The person who owns the rented house now says, pack out of my house, and throws you out in the rain. Your family, what will be the immediate steps that we need to take where we are planning for long term?
Well, there's been an increase to the health sector
in the budget.
So
in the budget,
is that part of it?
Yes, it's good, but that's a little bit long term, don't you think?
Yeah.
The children need the drugs. We're talking about the immediate, because I look at it immediate, medium, and long term. What are the immediate next steps that we need to take now? Who are the stakeholders that are supposed to come in to take charge of these immediate steps? With everybody, there should be a collaboration at this time. The CSOs, the private sector, the government. Look at we have to have an emergency meeting. We are being funded by international organizations. US is a great funder. What are the steps? The immediate steps. Where we look to the medium term and the long term. And long term is a good one, because at the end of the day, what has taught us now?
What are the short term steps in your view?
For instance, for the HIV drugs, we immediately need to start to give people HIV drugs. Because if somebody stops taking their drugs, what it translates to is that
viral load will be high.
Viral load will be high.
But what you have recommended is a meeting. Meetings take time.
No,
we like meetings in Nigeria.
No.
Meetings.
Meetings.
That's also medium term to long term.
No. Emergency meeting. I use the word emergency. There are some areas that need emergency steps. Those steps need to be taken immediately. You get what I'm saying? So for me, that is there. That is there. While we now call
Emergency steps such that Nigeria begins to buy the drugs or what?
Of course, immediately. For that particular type of thing. Because we talked about the focus. The focus really, from what Dr. Gafar told us, is basically tuberculosis, HIV, and malaria. HIV is an area that you need to take your drugs on a daily basis. So for me, and then there are many other areas, but it's a lesson for us in the sense that you cannot depend on another person.
Don't put all your eggs in
one basket.
All right. Thank you, Chika. Let me quickly get to Vivian Ihekwazu. Thank you for your patience, and I'm sure you've listened with keen interest to the guests here in the studio. What's your take on the pause on funding from the US aid, and how do you think Nigeria should begin to respond?
Thank you very much for that question. And I think Dr. Gafar and both Chika, who are, both we work together in the same sector, have really set the scene on the challenges, while Dr. Gafar kind of laid the groundwork on the funding. I think what Chika did, and I hope everybody keys into what she said, is the human cost of the pause in funding. Without going into the background detail, but what we know, especially in the area of HIV, is Nigeria has about 2 million adults and children who are currently HIV positive. And of those, about 1.7 million are receiving ART, antiretroviral, which is what Chika alluded to. So this sudden pausing in funding absolutely was not ideal. The suddenness of it, I think, really caught everybody, not just in Nigeria, but globally, kind of just really caught people by surprise. But we all understand, and we all have seen it over the last couple of years, 10 years plus, that geopolitics is increasingly affecting how countries decide to fund foreign aid. Post-Brexit, we saw the same thing, with UK funding decrease from the usual 0.7%, which was ring-fenced, to 0.5%. So what we're seeing is geopolitics is affecting the way countries now see the strategic priority of foreign aid, which brings us to Nigeria. It is very unfortunate that for decades, we as a country have been so dependent on foreign aid to fund our health sector. The vulnerability we are seeing now, and that vulnerability is going to see collateral damage in people, lives lost, children, mothers. US funding is probably the largest funder for many health programs globally. In the last fiscal year, they gave about $767 million to Nigeria. The vast majority of it, about $322 million, was for HIV, with about 292 for emergency responses and 112 for maternal health. So we see how we have been so dependent on foreign aid to fund our health sector. And I think this is a wake-up call. In the media, of course, we saw that the government has now allocated 4.8 billion for HIV treatment. But this is not funding that's going to come immediately. And the acute phase is now. And what we are going to see are a lot of programs that were receiving funding, maternal health programs, immunization, HIV especially. People who are at the grassroots, people who are on the receiving end and are dependent on these funds are going to suffer for it. The government, yes, we have seen them snap into action very quickly, with more funding suddenly allocated to health. Nigeria Health Watch is one of the many advocacy organizations. For many years, we have been advocating for more domestic resource mobilization for our health sector. We named a few: HIV, maternal health, immunization, but us also think about sexual reproductive health. We're also dependent on foreign aid for our commodities. So as a country, I think now is really the time for us to collectively realize, and for Nigerians themselves to start asking questions. We don't ask enough questions. We've just seen that the budget has been passed, 57 trillion. How many Nigerians are going to now look and see how is that funding going to be used? We see infrastructure given a lot of priority. Not to say that we don't need infrastructure in the country. It's great that we need it for economic growth of the country. But how are we investing in our health sector? How are we investing in education? All of those other human capital development initiatives that lead us as a country to economic prosperity. So in the immediate, the freeze on foreign aid from the US, it's their prerogative. These are US taxpayer dollars. But how are we ourselves as a country asking questions and demanding that health is prioritized? One of the presenters mentioned the death in Lassa fever. We've had Lassa fever in Nigeria for over 50 years. Until now, we don't have a viable vaccine. And each year, we're almost desensitized to the early warnings. When, in January, February, March, the acute phase of Lassa, every single year, we're reporting deaths every time. But we don't really push our local councillors, our local government, and our governors. How are they prioritizing health? And ultimately, I think this is the time for all Nigerians to really start stepping up and asking, why are we not spending enough on health? And this is really the time when we see funding suddenly being reduced. People are now realizing that we've been so dependent on foreign aid till now. So just to say that if any time this is a wake-up call, and a very painful one because of the deaths that will result in people not receiving treatment, etc. But I think we really need, as advocates, as media, to really start elevating health in the discussions we have on a daily basis.
Thanks, Vivian. You spoke about asking questions. I think that would be a long-term solution to this problem. When you ask the questions, you hope to get answers. I mean, that will take a long time. But how do we deal with this, in the immediate? Because you just raised another concern. I wasn't looking at that initially. I mean, the focus has also been HIV, malaria, tuberculosis, immunization. That's critical. I mean, with the support we're getting, I mean, we know what the statistics, say as regards children who still develop some childhood illnesses, and what the statistics is for child death, children between birth and 5 years. So tell us, what do we do now, just now, this minute, just so that we can prevent some of these deaths and, if you like, some complications that may result from this?
We need emergency funding. Where are the gaps that the foreign aid was filling before that we as a country now need to fill? Part of that budget should absolutely go to these emergency programs to save people's lives. So the simple answer is we need to see where those funding gaps are and plug them immediately, because the cost of that will be lives lost. I mean, just to reiterate, mentioning immunization, one of the main ways we get our immunization is through Gavi, the Global Alliance for Vaccines and Immunization. And recently, the UK government mentioned that they were going to do, in the next financial year, they were going to review the funding that they allocate to Gavi. And this is based on the broadened priorities in the UK. So even Gavi, that is a key source of funding, it's a key source of Nigeria getting its vaccines. The UK is already mentioning that in the next fiscal year, they may cut back as part of their wider spending review. So to your question, what needs to be done immediately? I think it's not just actually the national government. We also need to look, because health is really local. So our state governors, who really, as a federated country, have a purview over health sector as well. How are state governments plugging some of these funding gaps? If we look at immunization coverage, I'm using immunization really as a proxy for some of the bigger issues we have. We look at our immunization rates across the country. It varies from some states having vaccine rates of over 10%, to some having as low as 10%, to some having as high as 70+%. We look at polio. Whilst we celebrated that in 2020, while polio virus was eradicated in Nigeria, we currently still have cases of circulating vaccine-derived polio virus, which is an urgent need and a big concern. And we mentioned USAID. There are many other funders that have allocated a lot of money to some of these interventions. For example, the Gates Foundation have allocated over 47 million globally to eradication of polio. And in Nigeria, they've spent significant amounts of money in polio eradication, but we still have cases of children who are still not immunized. So this still goes back. In the immediate, we need emergency funding to plug the gaps, but in the medium to longer term, we absolutely, as Dr. Ghaffar mentioned, domestic resources need to be allocated to health. We know that we do have many competing priorities in the country, and the cake is not getting any bigger. But we need to grow the cake in terms of how much money the country is generating, but also look carefully at where are we allocating funds that we could now use for the health sector. Because if you have an unhealthy population, all these other things we're looking to fund, it turns to nothing. So really, absolutely, we need urgent domestic resources for health, and longer term, we need to really think carefully, how are we prioritizing the Nigerians?
Thank you very much, Vivian Hekwazo. Dr. Olawode, she was talking about competing needs. I was going there because the same way you have a minimum threshold in health that is okay, the budget must have certain percentage, there is in education. There is in a hostile world, there is in defense, there is for infrastructure, and a government wants to be remembered. Nigerians judge by what they see, not what they don't see. So where do you think that this finance can come from in the immediate?
Okay, thank you very much. As long as we are talking about immediate emergency, which is very, very important, but I want to call your attention to the fact that the danger of emergency mode, emergency thinking. Don't forget that the problem we're having with HIV/AIDS started because of the emergency approach to HIV/AIDS. PEPFAR was Presidential Emergency Fund and all those stuff like that. And when we started, we are not actually thinking of sustainability, what happens after when we get out of the emergency. So we're in emergency phase for a long time. What am I talking about? I think as we are talking about how to address immediate problem, which is germane, which is, of course, there's no doubt about that, we should be also thinking of a more sustainable way of financing. The good news is this: for all the disease areas that you have, whether HIV, TB, malaria, immunization, whatever, there is already a roadmap, sustainability financing roadmap for each of them. My organization, the GI Consult, and others, we have been part of developing this roadmap for long, looking at where would the money come from, what is actually needed. There are a lot of analysis that have been done. What is needed to finance this program area? How much is coming from outside? How much is coming internally? What is the gap? Where do we get more money locally? Looking at a traditional increase in allocation and releases and innovative financing as well. All those ones have been identified. The only reason why those have not been activated is because donor money was still coming. That's the reality. So I think what we need to look at all these disease areas, to identify what the first step is what government have done, emergency funding, release money out there now, so that what my colleagues have said in terms of imminent deaths that could happen and everything, let's get the drugs and everything, emergency funding from whatever where government will get it, and that has been done, you understand. But beyond the emergency funding, we have to look at what is sustainable way of financing health. The truth of the matter is that within the existing funding framework, so federal government is doing like 5-6% of health and everything. And if you ask federal government, I spend a lot of money on security. Everybody knows that even if there is no security, nobody can go to health facility and all those stuff. Infrastructure we are talking about, without infrastructure, you cannot even access healthcare. So there is a little room, that's the reality, for government to say, okay, I'm increasing this 6 to the 15% we are talking about. Even those that advocated for that, when they get to the National Assembly, they are saying different thing entirely.
What about private sector?
So this is where I'm coming about. Everything is part of the overall unpack innovative financing thing that we're talking. A lot of analysis have been done. And then if you want to solve a complex problem, ask two questions. The first question is, who has dealt with it before, and what can we learn from them? Ghana, our Anglophone neighbor over there, part of how they have increased funding for health is to introduce, increase the value-added tax. I know tax, whatever, is a big problem in Nigeria and all those stuff, but we have to face the reality. That's the truth of the matter. VAT in Nigeria is only 7%. In Ghana is 12% or 15% or thereabout on the road. And they increase it and they earmark it for health, 2.5, whatever. Nobody wants to pay more tax, not even myself. But when people say that my tax is going to be for service and I will see the service, the compliance tends to increase. So there are a number of areas, alcohol, tuberculosis, that have been analyzed that if we increase tax over there, we can plow the money back to
but
the
you
health
see,
sector. Yes.
Dr. Alaude, you know, what comes to my mind at this point is if we're ready as a nation to deal with the challenges. I ask that because, I mean, when we had COVID, there was so much stories about Nigeria producing its vaccines. Where are we? I mean, it's how many years down the line? Have we made any progress?
Good progress. And I think, you see, the truth of the matter is that there is an initiative of the government. It's only probably government is not really publicizing whatever. They call it PIVAT, the value chain, whatever, to actually strengthen all the value chains of health. Because part of the lesson that we learned from COVID that they are using for that is that during COVID, nobody could export anything to other countries. So everybody was, there is a vaccine nationality or something, everybody, actually trying to prioritize their country, which is only normal. So what we have learned from that informed government policy is introduction of that initiative, where there is already a plan to look at what are the manufacturing line that Nigeria is going to spend a lot of money. Maybe one of these days you invite Dr. Mukhtar to come and talk about the value chain strengthening, which is one of the pillars of our Professor Pati's health sector. That is already happening. But all of us need to work together to ensure that from policy.
So are you saying that the basic vaccines are being produced in this country at the moment?
Maybe not yet, but there are a lot of things that are being done towards that are not being done before. You understand, in terms of looking at how much does it cost, how do we mobilize the money, and how do we, because the issue of production in health sector is not only about the manufacturer can produce, they can come and produce, but there must be market in terms of somebody putting money to buy this thing. So that is the entire value chain we are talking about that the government is looking at.
But let's also talk about homegrown solutions to some of the prevailing health challenges that we have in this country. COVID, of course, also raised that concern.
Absolutely.
And, we were talking about homegrown solutions and all. I mean, we're talking about malaria now. If we had homegrown solution that was tested and trusted, I mean, we'll just fall back. Tuberculosis, the same thing and all of that. So tell us, where are we? What are the issues?
So I think one of the issues, like I said earlier on, in terms of when you say homegrown solution, there are several facets to it. But central to that facet homegrown solution is that resources is very, very key in terms of having pool resources that even when somebody produces locally, there must be sure that somebody is there to buy and make profit and continue.
You're talking about buying. You see, that's not what is in public domain. It's not about buying. That's not the issue. But maybe you have an answer to this question. Homegrown solution to some of the health problems that we have in terms of manufacturing of drugs, all of that, vaccines and all. Are there challenges? Where are we as a country?
Okay, so before we become very excited, Nigeria was importing most of the drugs that we were using. Even vaccines are being imported. The focus we have as we speak, I like to be very, very real. As we speak, we have almost 8 million Nigerian children that are born every year. Those children need vaccines. And the funds for those vaccines have to be generated. And domestic resource mobilization is the key. So for us to be able to own our vaccine story, we have to manufacture eventually. Gavi has dropped about, I think about $2 million in this particular direction. because it has become clear to everybody that in the final analysis, Nigeria is a very big country. We need to start to manufacture our vaccines and many other, Pfizer has left. Pfizer, was it not Pfizer that left Nigeria? All those things happening. We get it. The minister gets it. The only thing I can say now is that those conversations are on board. We have different committees that are working on them. Gavi is supporting and they've dropped some money. So I'm very excited. It is not yet Uhuru, because I can see from your face they are wondering what is happening. It is not yet Uhuru. I'm not going to tell you that I've started producing vaccines. We are not. But what I'm saying is that the template, the conversation, the movement to make sure that eventually we get there is happening. And it starts from domestic resource mobilization. For me, the most important thing right now, is prevention. And immunization / what? Prevention. What prevents disease? The poor man is already poor. The only thing that can save him now is to make sure that those diseases that could have gotten him is prevented through what? Vaccines. The next level is those vaccines must be purchased. Government must release money for those vaccines to be purchased, while we are preparing for when Nigeria will be able to say we want to start producing vaccines.
That we are talking about, and I've asked earlier, we have a lot of business moguls who do a lot of philanthropy.
Yes.
So why not in health? Is it that somebody is not making the advocacy? For instance, is it possible to launch a fund to get people to donate in the immediate and they begin to get results? Is it possible?
Of course it is possible. I'm happy we're having this conversation. And NTA is part of the media. CSOs are part of it. Let us come together and start to have this conversation. I'm happy you are bringing it up. But you also have a role to play as well. It is not just about CSOs. All of us, I see that
we're playing us.
We are playing that role now, and I'm happy about it. And I'm telling you that even Gavi has dropped $2 million on this particular thing. We realize the value of us owning our vaccine story. If COVID did not teach us anything, it taught us that every country for themselves. Okay. And America has so I want you to know that the conversation is ongoing. But the planning is ongoing. It is not yet Uhuru, but it is ongoing.
How long will this conversation take place? I mean, COVID, it's about 4 years now. But like you said, we're hoping to see all of this, translate to, a reality on ground, and of course the changes. I agree with you. But you talked about prevention as being the way to go at this point. But I want to ask Vivian how prevention can help with the HIV story. You said at the moment we have about 2 million people, adults and children, who are HIV positive and who are on medication. We also know, as of December last year when we had the World AIDS Day, the statistics shows that more children are coming down with HIV as a result of mother-to-child transmission. Yeah, so in the interim, while we're trying to sort out those who are already positive, how do we deal with that mother-to-child transmission, which will likely, continue? And of course, those on ground, you don't even have medication for them. So, just help me deal with this.
Okay, thank you so much for that question, because the answer to that question is a lot deeper than just looking at it from the perspective of HIV. When we talk about prevention of mother-to-child transmission of HIV, it goes down to our maternal health care in Nigeria. In Nigeria, we have one of the worst maternal health outcomes globally. We're probably one of the countries where many women die just giving life. And the reason why I say it's a lot deeper is it goes down to the primary healthcare system that we have in the country. When a woman is pregnant, the first port of call for that woman should be at the primary healthcare level. Why am I saying this? Because it's at the primary healthcare stage that when she's pregnant, she will get screened for, the usual tests you have as a woman, your high blood pressure, your urine, and you'll also get tested for HIV. So the failure of our country to have a strong, robust primary health system is the first point at which we fail many mothers, because that's the point at which these things would be addressed. So the screening for HIV for a pregnant woman would have been done or should be done at the primary healthcare level. So it's not something that we can say there's an emergency immediate response to. The bigger question goes back to how is our health sector catering for the needs of the country? And maternal health is, if anything, the proxy of how as a country we prioritize health. Because until we start caring for women at that first stage when they're pregnant, we will see all of these outcomes, because that also translates to immunization. It translates to sexual reproductive health. What access does she have to sexual reproductive health services and commodities? So the story or the immediate response to prevention of mother-to-child transmission comes back down to how are we funding and strengthening our primary healthcare system, which at that stage is where every mother would go when she's pregnant to get all the necessary screening she has, high blood pressure, everything else that that is required. So I think this discussion and the funding freeze has really highlighted that health, as we saw with COVID, is the fulcrum around which every economy is built. And until we start prioritizing and funding it adequately for the Nigerian people, we will keep on seeing all of these outcomes. Just very quickly, we were talking about vaccine manufacturing. Why are we not manufacturing vaccines? I'll go back to a comment you made about the number of deaths of Lassa fever. We've had Lassa fever in the country for over 50 years. There's been no viable vaccine, and there still is no viable vaccine. However, we have organizations like the Coalition for Epidemic Preparedness and Innovation, CEPI, who are funding vaccine R&D, research and development in Nigeria. And parts of that is we can't just wake up tomorrow and just start manufacturing vaccines. There's a whole ecosystem that has to go around it. How are we funding our education sector to produce sciences, to produce scientists? How are we funding our research institutions to even build their research capacity to get us to a stage of even producing vaccines? So I think, the holistic answer is not just why are we not producing vaccines. There's a lot more that goes into producing vaccines, because vaccines are biologics and it's a lot more complicated than, for instance, just manufacturing paracetamol, which we're able to do. So this is a bigger discussion around how are we building the science infrastructure, the ecosystem that will enable us as a country to produce vaccines, the research, the manufacturing capacity. There's so much more that goes into it than just asking, why can't we just produce vaccines on its own? Thank you.
So, Vivian, thank you very much. I'm just wondering, I'm not sure if the National Council on Health has been held this year, because that could be a fertile ground to begin to have these conversations. But if the date isn't set and it's not time yet, we are talking about getting things going. And I keep asking, who should take the lead if it comes to mobilizing the private sector? I see it as an area of immediate response. Do you?
Okay, thank you very much. I agree with you to a reasonable extent that the private sector play a very important role. But the good news is that we now have a mechanism for mobilizing private sector resources. Part of the challenges with mobilizing private sector resources is how do we coordinate it so that we are not going after one private sector or the other, which could be very inefficient. So that is
let me help with that, perhaps, because we've seen it happen before. Let's say the president sets up a fund, pulls the private sector together and takes the lead. I think, can't we see results?
Yeah, we can see results. And like, for example, there's a HIV trust fund which was put in place and everything, but probably because we were still getting external financing, probably we are not paying attention to it. So where I was actually going, so we have a private sector health alliance in Nigeria that has done a very, very good job in terms of bringing the real philanthropists that have the resources together. And it has very worked in certain areas where they pull resources together. As I speak, there is a Adopt One facility per local government that the private sector health alliance has led, that have brought Dangote and other big philanthropists together. I think we can use the same model as much as possible. The leverage is always there to get private resources. I think we just need to, I agree with you in terms of the having government political, more political support, it encourage more private sector to come in. But beyond that, I think as we are thinking about this emergency mode in terms of where the resources will come, there's something we have to take into consideration. How the aid is being delivered through, of course, foreign resources. We have to ask our question, how efficient is it? So that if we want to use our money, are we using the same template? Is it possible that what US dollar, $1 is buying with aid money, we can buy 10 times it, looking at local solution, looking at area of inefficiency, looking at the additional costs that come with international organizations supporting you, because substantial part of the money go back to the parent organization for one reason or the other. So this efficiency question is very, very important. Beyond the efficiency of the emergency mode, Nigerian health sector is highly inefficient. It's highly inefficient in terms of even when we allocate money, what proportion of that money is released? The money that is released, is it by what's supposed to buy? There are instances where the bulk of money spent, if you look at a typical state in Nigeria, the bulk of spending on health goes to human resource for health, doctor, nurses, and all this stuff. And that is why highest level of inefficiency in terms of ghost workers, in terms of those that are not ghosts, not going to work and everything. So the improved domestic funding discussion should go with how do we get value for money in that. And all of us have roles to play, including the media as well. It's very easy to say government spend more, and spend more. But without looking at how do we get the best result. And we have local examples of where states have done something differently. In Gombe State, when the governor came on board, he discovered that the bulk of the money in health education is going to paying staff, and it's asking what is the result that we're getting. And they now discover that there are a lot of health workers, there are ghost workers, there are some that are being paid that are not
Dr. Alawade, as you speak about ghost workers in the health sector, it just takes my mind to, is it possible that, those, anyways, maybe I shouldn't say that on air, but I mean, it's quite funny, really, but having ghost workers in the health sector, because I mean, a lot of people are dying as a result of the inefficiency in the health sector. So, I mean, are they now recruited, after they pass on? Anyways, but you see, let's get to Chika for, we're talking about resources, which is critical. It's key to deal with this issue. But what about the medical personnel? I mean, before this, we had a crisis. The Jacqua syndrome is with us. So, I mean, we need more health. I mean, with this funding paused, more people are going to fall ill. We need more personnel to attend to them. How do we also deal with that? Of course, I know that the Ministry of Health just increased the retirement age to 65 and all of that. Is that outside that? What other things should we be looking at just to make sure that our health sector is really healthy?
Okay. So before I answer that question, I just wanted to ride on what my sister Vivian talked about when he talked about maternal support. One of the most important things that we need to focus on is continuous education. A woman or a mother cannot know that something is wrong with what she is doing, and she will do it. When a woman does not vaccinate her child, it is because she does not know that vaccines are valuable. So for us, we should not play with continuous education. So for us as CSOs, as government, as all that, we need to continually educate the woman in the community, the family in the community. And then the government has what they call the whole family approach that looks at a very family-oriented approach to many things. We cannot forget that. So I just needed to put that on the table to support what Vivian talked about. And then you talk about, now that we are faced with this elephant in the room, which is there's no funding coming, it is time for Nigeria to be strategic. What are the most important things? Because the truth of the matter is that the funding, the money that we have, let me simplify it because I'm CSO. Let's simplify it. The funds that we have cannot cater to all the agri, health, so now it's time to prioritize. The country has to determine what are the most important things in health that need to be done, that we cater to the citizens, that we save the lives of the citizens at this time. And the preventive approach is one, which is vaccines. A lot of focus should be around making sure that funds for vaccines, after being budgeted, are released. To buy, first and foremost, you have to buy the vaccines. And there's a lead time. The lead time means that if you want to buy a vaccine, it's not like you just carry and go to the market and you see vaccine to buy. That's not how it works. You order. Sometimes it takes 6 months before those vaccines arrive. So Nigeria has to be very intentional, strategic, to make sure that funds are released on time to make sure vaccines get to where they will get to. You get what I'm saying? Because we're talking of more illnesses, we're talking of this. Vaccines cuts away many of these things. So we have to prioritize those things that are very key at this time. Human resource is another one as well.
I was coming to human resource, and I wanted to take that because we are running out of time. We're going to round off this conversation shortly. So let me get to Vivian with that. We've been talking a lot about funding and finance, and we have Nigeria is losing in droves our health professionals. And I know that the USA thing is not just about money, it's also about professionals and who are also going to be pulled back. So are we prepared? How do we also plug the gap in terms of manpower?
Very much for that question. You know, we all talk about, you even mentioned it, about the doctor who was treating a patient and has now left the country. I think every single one of us can share stories of doctors we know who have been trained in Nigeria and have left the country. And that's not something we can immediately stop, because people have the right to leave if they choose to. And the reasons they're leaving, we all know it: poor working conditions, poor pay, training opportunities, etc., etc. But the question is, how are we responding to that? One of the things the government is looking to do finally and now is to train more health workers. We can say that by training more health workers, why they're going to just leave. It's true. We need to train more health workers. Some will stay, but many will also. Some will stay, but some will leave, but many will also stay in the country. And we need to train people, not just doctors, nurses, midwives, lab technicians, at all cadres. We need to be producing more health workers. It's finally reassuring to see that we have a health work policy on migration that has finally been drafted. Because historically, we've never had a coherent response to the departure of health workers before. And it's only now, when the situation is quite acute, kind of almost accelerated by the worsening economic conditions and working conditions for many doctors. So the response, absolutely, and it's reassuring to see that we are employing more doctors, and we also need to produce, we need to train more doctors and nurses, technicians, midwives, etc. in the country. Because as long as we don't have enough health workers to address all of these problems we're talking about this morning, the health issue and the health conditions for many Nigerians will only worsen. So in the immediate, we need to be training more doctors in our medical schools. And yes, we do know some will leave, but not every doctor that has left genuinely wants to leave. Many would stay if the conditions in the country were better for them.
Vivian Kwazu, we're about to round it off this conversation. We have a second leg, to the program today. But I'd like to hear your final thoughts, Dr. Gafar Alawade, as we round off. Your thoughts, what you think we can do, recommendations to government and also to Nigerians.
Okay, thank you very much. I think I'll still go back to the initial thought around we should not allow this crisis to go to waste, because we should seize the opportunity and try to look at the overall financing architecture for Nigeria, in terms of how those things that we have been identified in terms of opportunity to spend more and spend better on health, how do we translate those policy to action that would benefit all the Nigerians? But more importantly, how do we raise the accountability bar for financing our health in Nigeria? All things that we have said, they are very good, they are nice things, but without raising the accountability by tracking who is spending the money, and the media have to play very, very important role to play. For instance, all of us come from one community or the other, and we are supposed to have a basic care provision fund facility in every ward in Nigeria. If I go back to my own word and say that we are supposed to be getting this, are we getting it, and not do stuff, we are using it to raise the accountability. I think it's going to be extremely important, the issue of accountability, the issue of efficiency of spending. I spent the earlier on probably did not really understand the magnitude of inefficiency in the health sector, because the truth of the matter is that even the health workers that we are talking about, those that are leaving, it will shock you that in many states, the salary is not going down. Health workers are leaving, but the salary is not going. But guess what? There are still health workers that are not employed. So why can't we use the money for those that have left and recruit as well? And that is part of the huge...
Plug-in holes.
Exactly. So I think it's very, very important to look at two simultaneously.
Thank you. Just maybe a minute to round off your thoughts.
Okay, yes. I just want to say that, like what Dr. Alawode said, is an opportunity. But our strategy should be immediate and then long-term. And then for that immediate, the preventive approach is very, very necessary now, which is vaccines. And those vaccines have to be funded. Domestic resource mobilization. We must own our story. We must own our story. And we must plan. And all of us, collaboration, all hands on deck. Media, CSOs, private sector, government. If all of us put our heads together, we'll make it.
All right.
I'm very optimistic.
Vivian, just in 30 seconds, I'd like to hear your final thoughts as we round off.
For me, one thing I keep on saying, and just very quickly, elections in many countries are lost or won based on the health policy. In Nigeria, they're not. I just think at this point, it's time that Nigerians as a whole start looking at health as being one of the strategic priorities of the government, and starting with the primary healthcare system. Next time your governor opens a big 500-bed hospital, ask yourself, is your primary healthcare working? At that very basic level, do you have a functional primary healthcare system in your state? That should be the beginning of where every problem we have in health should be solved. And that's where we need to start funding and making sure that that level is strengthened to improve health outcomes for all Nigerians.
Going to leave the conversation. I really loved what you said, Vivian. Elections in many countries are lost as a result of policies towards the health sector. I think Nigerians need to think in that line. Many thanks, Vivian, here, Managing Director, Nigeria Health Watch. It was a pleasure having you on our program, and we wish you the very best. Chika Ofo, Health Advocate, thank you so much for joining us again. Thank you for your time too. And Dr. Gafar Alawode, expert in health financing. We hope you bring in more money into the health sector somehow, and we can do the job.
Yes, everyone has a role to play. I hope that we're playing ours, so others should play theirs.
Yes. Domestic resource mobilization. We must own our vaccine story.
All right, so we'll take a break. When we come back, we'll get into the second leg of our conversation today. Please, leave it locked. All right, you're still on to Good Morning Nigeria on the network service of the NTA. We'll begin our next conversation on the recent passage of the 2025 appropriation bill of 54.9 trillion naira.
All right, and we're now being joined here in the studio by Dr. Meka Okengo, a development economist and farmer, very important. A pleasure to welcome you to Good Morning Nigeria.
I actually appreciate being called a farmer. Good Morning Nigeria.
Now, 54.9 trillion naira budget passed yesterday by the National Assembly, the biggest in history. Well, in some quarters there is excitement, but beyond the figures, what does this mean in practical terms for Nigeria and for Nigerians?
Okay, let's stay with the figures before we go beyond the figures. I mean, it's not the biggest if you juxtapose it with the costs and exchange rates we had in the times past. You might be shocked that it might be one of the smallest. Okay, if you now start exchanging that at the rates we used to. So I think it's also consequent on the price of forex. Okay. Now, having said that, it's a good way to go. I see some very interesting moves by government to be able to address issues. I mean, the injection of 300 billion into the health sector to hedge probably the funding supports that we get externally. It's a very good move for me because I am not a proponent of aid. Okay, so it simply begins to start a process where we can start owning our own process. All right. But having said that, I also would have thought that in our development stride, especially with the government's commitment to food security, and livestock development. And this is where me being a farmer would come in. I would have thought that a lot of focus should have been put in that area, especially vis-a-vis the allied infrastructure you need to be able to get, food security in place, and that will be energy. Having also said that, I'll close on the fact that now that we're getting more independent and we're looking inwards, I would have also wanted a situation where we would have looked at the steel sector. Now that the solid mineral sector was allocated $1 trillion, okay, because solid mineral sector is actually the back end of the steel sector. I would have said that yes, government is working towards privatizing our steel facilities, but there's a lot of work, that needs to be done for you to be able to, attract that kind of investments, especially knowing that steel is development and development is steel. I didn't see those areas, getting the kind of attention I thought they should get.
All right. If you say those, the other areas that got priority, would you say that that's putting the right peg, or if you like, the right peg in the right holes? Talking about education, healthcare, and then outside the 300 billion, which is for the health sector, the extra 400 billion. I mean, the budget was increased by about 700 billion. Would you say that that's necessary?
Well, because we don't have the back end, we don't have the narratives. Okay, we don't have the history to that increase. Well, what's important is that the people who increased are allowed by law to increase it. So that would be the argument. I don't argue what I'm not able to, interrogate. For me, 54 trillion for a country of 200 and something million people is very minuscule. It's very small. I mean, this would be a budget of a small mine, okay, or a medium-scale mine somewhere else. There are corporations who run this as their departmental budget, because you're technically talking about $36 billion, dollars or something in that range. So when you're hearing trillion, that's what I'm saying to you, that if we drill it down, you find out that this is not a lot of money. I mean, 36 billion for a large corporation might just be money that are allocating to research alone. You're right. That's my point. So if we want to move from where it is, I mean, we should be aiming at trillions in dollars in our budgeting system. But we have to now look at those priority areas that can be able to unlock it. Why wouldn't we be like China? China today is talking about, creating artificial stones, creating artificial moons, creating all sorts of things. And why are they doing this? Because they are focusing on their steel sector. Look at every other country in the UAE that have oil like we do have oil. There was a deliberate action to exit, oil and move towards steel. Go and check it out. All of them have, are now in the trillion, economy scale because of their utilization of steel and allied outputs. So that's very key. We have a new economy now just because of creating it. I mean, the blue economy has generated, from what it is I read, billions and billions in dollars by just aggregating, imagine if you put a business aspect to that. Imagine if we have ability to be able to now create those things that can, facilitate the things that happen in our blue economy. Being able to build our ships and boats, being able to, replenish our waterways, being able to train the human capital. These things are areas I think that we should be focusing on. And then that brings me to the fact that I didn't see a lot in the way of research. Because whatever it is you do, R&D is critical and central. I didn't also see a lot of allocation to our research institute and centers. These are very key areas for me. Health is fine, but health depends on research.
Well, now that we are here, I had asked earlier, what does this mean in practical terms for Nigeria? You've picked a lot of holes. Well, in the process and maybe the final outcome, what does this mean in terms of everyday living for the Nigerians?
Well, I think it means that there's a determination by government for us to start thinking right and working right, and that should be commended. That's what it means. It simply means that all of us, and nobody is going to be spoon-fed again, okay? It might be tough, okay? Like they say in sports, for those who are sports people, the first thing they tell you is no pain, no gain. Okay, so the pain is here, no doubt about it, but the gain is in sight, and that's important. So our role is to probably, nobody has, it's only God that has knowledge about everything. Why you bring in people on your shows is probably for us to be able to take it from angles that can be able to now get government to begin to look again. So I think it's a good move forward. Nothing is cast in stone. Okay, this is not the only budget we're going to be having. But I think those critical areas, like we looked at the health sector, we should have also now identified these other critical areas. Yes, we talked about education, you're right. But education has to be tied to, what you call the realities on ground now. Formal education, A, B, C, D, in my own language, is no longer the way to go. Okay, now, if you're going to be walking into this web-based AI kind of education, you need to get the tools. And if you start producing those tools locally, this is where science and tech again comes into play. Then imagine if we could start making computers and tabs, for our kids in primary school, and then we're localizing that production. Do you know what that would mean? So these are the kind of things I'm talking about, really.
Did we get our priorities right, in your opinion, for every area, if you dissect?
As a development economist, I would say it's work in progress, because it's really unfair for you to sweep away a lot of work people have done. We could have done better than we've done now. Okay, for me, taking it from the perspective of this new Nigeria that we're working towards. And remember, it's a 15-year match. Sometimes when people will hear about the 15 years thing, I tell them that that's realistic. I mean, it's not even going to be realizable if we don't keep faith, to the match and the demands of a match. So those priorities, if you want to get it right, will be to now classify it under three broad, factors or variables. One, your human capital. Two, your natural resources. Three, your technology. That's what grows a nation. Now, if you're able to turn your human resources into human capital, then you become competitive locally and internationally. If you're able to turn your natural resources, into products that can be globally, competitive, you now start, chasing a position in the Committee of States and, the global markets. Now, the way to do this is technology and education. So if you're able to fix your education, all right, and then get people who are skilled, all right, and it becomes the basis of moving forward, then that's the way to go for me.
All right, many thanks, Dr. Okengo. But looking at the specifics of this budget, 54.9 trillion, 3.6 trillion is for statutory transfers, 14.3 trillion for debt service, 13 trillion for recurrent, so that's non-debt expenditure, while the sum of 23.9 trillion is for contribution, to the development fund for capital expenditure. Looking at how the 2024 budget, performed, do you see this, hitting its targets?
Yeah, I do, but I also see that there must be synergies. Okay, if this is the federal budget and not the national budget, it's important you also, make that distinction. If you're talking about the national budget, then we won't be talking about, the 54.9 trillion. We'll be talking about 59.9 trillion, inclusive of a budget of the subnationals. Then you can now have a whole. Okay, but this is the budget of the national. Okay. Or federal government of Nigeria. Now, what happens to budgets is that usually there are financial plans that you couch in figures. So it is one thing to have a budget, is another thing to be able to fund the budget. All right, and it is the funding aspect of the budget that actually now determines if you're able to hit target. It is not the money, because this 54 trillion, like they also listed, is not in any vault. Okay, waiting to, be packed and then given to people. So there has to also be, getting the money and then being able to, fund the projects.
Now, the much vaunted January to December budget cycle seems to have been lost now, at least with this year. Does that have any implications?
Well, for me, budgets are not supposed to be. This is why we had what you call the rolling plans way back. Okay, budgets are not supposed to be cast. Maybe you're recurrent, yes, you can do it. I mean, you need to pay your staff and then get what it is you need to run that, financial year or something. But when it comes to capital budget, it's almost impossible for you to, be able to accomplish most capital projects within a 1-year cycle. Okay, and some of the aspects of this budget will be seasonal, will be season based. Okay, because if you're looking at agriculture now, for instance, if you have not released any money, or if you're not going to be releasing money to agriculture now to go and do whatever that needs to be done, land preparation, land plowing, land clearing, seed acquisition, ABCD. If you release that money to them in September, there's no way you can expect them, to hit target by December. Even if you give it to them by March, because the procurement process will now begin to also now take its own run. So what's important is that our budgeting system, for me, if I'm to advocate, we need to return to the rolling cycles, so that whatever is left is rolled over. And then you don't even need to roll over by going back to the National Assembly. You can just have, a 5-year program. Like you just have your MTEF, okay? Just roll it over for 5 years, and then you can now begin to, against your MIE, against your outputs and inputs, you can now begin to either add or retract or whatever. Okay.
All right. As we begin to round up this conversation, for you as an economist, you understand these figures. You may likely understand, how government does what it does. But for the average person watching you at this point, hearing these figures is just, they've come again. It's another budget. I mean, what really needs to be done? How do we, bridge the gap such that the average Nigerian feels the impact, of this budget?
I think the first thing to do is to know that the local government chairman is like the president in that local government and has responsibilities. That's the first thing to do. And to now begin to call out people. Okay, this is where transparency comes in. Just like you talk about the ESG, okay, the environmental sustainable governance programs that is being promoted everywhere now for transparency. The second will be for an alignment, and this is very important, of the national and the subnational budgeting systems and programs, so that everybody now knows where he ties in where. Because for all of us now looking at this national budget, and we're forgetting we come from states and local governments. So for the average person, what needs to be done is that there has to be information on what government is doing and how what government is doing at local government A, okay, ties to state A and ties to the federal government vis-a-vis that circle. So you will not start building economies, you will not start building belts, project belts, okay? That's the way to do it if it's going to be impactful. So that when that money is released to the Ministry of Agriculture, you know that another money similar has been released to the Ministry of Agriculture in a state. You know that something similar has been released to the federal local government in a state. Now, being part of that system is for you to now go to your local government chairman, if you can, and you should, to say, Oga, this thing that is happening in Abuja, is it not supposed to be happening in our place? And it's supposed to be, from what it is, I know that's happening. If that is done, then you can begin to now have proper citizen participation in the development, process of a country or a society.
And of course, it's one thing to budget; it's another thing to implement it. Do you see this budget be, implemented 100%? Of course, begin, for instance, with funding.
Yes, I see determination. I see determination. I see a determination for there to be a paradigm shift. No matter how much you want to look at it, I see the federal government determined to do things a little bit differently. And even if you look at the renaming of some of the MDAs that are operational now, you will find out that there's actually a very determined effort for government to move from where we were before, okay, maybe blue and red line, to something a little bit artistic and innovative. As for full implementation, like I said earlier, it is going to be driven by the availability of funds. So
where will they come from, the funds?
Well, we're doing well in funds. Some of us are struggling now. Some of us are now putting off, like in my own case, I'm not ashamed to say it, I turn off my NEPA by 9 o'clock or 8 o'clock and I go on inverter. If it juices out, so be it. Okay, I'm able to get lights up to the morning, so be it. So everybody, even at that, but you're still spending money. Okay, we're contributing. Taxes are being paid now. More people are beginning to get tax conscious. And it's going to, get a little bit tougher. So government is saying to us that they are doing a lot of savings from both subsidies of energy, because a lot of people do not realize that you have more subsidies in the energy sector than you even have in the oil and gas. So if we are getting all these savings from these subsidies, government, even if it's not awash with funds, should be able to get credit worthy to make up whatever it is that it's getting. So I don't think funding might be such a huge problem. I mean, look at solid minerals. I mean, an agency in solid minerals, the mining cadastre office, generating over $1 trillion. Okay, I mean, it's a big deal. Okay. Yeah,
all right.
So what's celebrating?
Many thanks, Dr. Emeka Okengu. Many thanks for joining us for this conversation.
Pleasure to be here.
Development economist. Always a pleasure to have you.
It's always a pleasure to be here. It's a privilege. Thank you.
All right. So that's our bit on Good Morning Nigeria this Friday. Many thanks for watching. Enjoy your weekend. By the way, it's Valentine's Day. I hear that Victor has plans.
Well, I am Victor Azu. No plans for Valentine, but happy Valentine's Day.